Assalamu alaikum whenever you are. Nowadays, actually, we all are concerned about the coronavirus and what we can do, how we can protect ourselves, and all of this in all of our countries and people. So, in this video, actually, I will explain a little bit some informations about the coronavirus and the disease. First, I'm actually a researcher in South Korea, and also I will tell you about the story of South Korea and how they could fight the corona cases in Korea. But first of all, let me give you a hint about actually the coronavirus. So actually, the coronavirus, the novel coronavirus or SARS-CoV-2, it's actually one of a member of a big family called coronaviruses. They are actually a type of RNA viruses. That's actually be also included the SARS that actually appeared on 2003 and MERS or Middle East Respiratory Syndrome that's occurred and appeared on 2012. And now this COVID-19 or this actually caused also by coronavirus. So it's not only one virus actually, it is a very big family of viruses. So very simple, the virus actually or coronavirus or this actually RNA viruses, very simple structure. They are actually not a living organism unless they are find the cell as a host to be alive and replicate it and reproduce and do their own functional. So very simple structure containing of the viral envelope from outside as a protein as a sheet, and the inside there actually is the genetic materials or the RNA. Okay, so the viral envelope actually is a virus used to identify the cell and enter the cell itself. How actually this coronavirus infections occur? It's actually called through the aerosols or the mucus, actually, which is containing the virus particles. So that is not spreading through the blood or anything. It's just the virus particles that actually exist on the aerosols or the mucus. So what actually or how the virus can enter to our body? So it's caused actually COVID-19 or confirmed coronavirus 2019 disease. This is actually a respiratory disease. So the virus particle when enter through the eyes can be enter to our body through the eyes or nose or mouth. When they enter, they go to the cell, especially the lung, and they actually blast the cell and cause many destruction. Now, what actually is the symptoms of the coronavirus infection? Symptoms, there are actually multiple symptoms, but there is three actually most likely all the patients show these symptoms. The first actually is a fever. You will have a high fever, then a dry cough, and also shortening in the breathing. This is actually the three. It also can be with other actually respiratory infection like a normal even flu or other stuff. But there is no anything can make sure that you have actually coronavirus infection only by the actually laboratory test using a PCR or other way. But these symptoms, most of the people show it. But there is actually some symptoms you really be careful and you need a really medical emergency, especially there is in the three cases. One, if you have trouble in breathing, really trouble in while you are breathing. The other actually, if you have a really pain or a pressure on your chest. And the third, if you have a bluish lips or face, you need to seek a medical emergency right away. Okay, now we know that actually coronavirus, it's spread through the virus particle that exist in the aerosol or mucus. So the question now, and we need to know it, how actually long it lasts this particle in the air or the surface. There is different depend on the surface actually. So the first, this virus particle in the air can stand for only 3 hours because it uses a UV in the air from the sun can destroy it actually the virus particle. So only in the air for 3 hours. On the surface depend on the type of the surface. So if on the surface made from copper, it's last for 4 hours only. In the cardboards or papers can last for 24 hours, like 1 day can also be able to cause the infection. The most worst actually is the plastic surface and the stainless surface. The virus particle can be active also and able to cause infections for up to 3 days. Okay, so now we know the symptoms, and also we know the how long it stay in the air or whatever surface, how we can protect ourselves. Simply very easy way, through very some steps. First, actually washing the hand with soap at least 20 seconds. Why at least 20 seconds? You should wash in all direction your hand for 20 seconds to first actually causing the viral envelope to be destroyed by the soap materials itself. Then the virus will not be able to enter to your body at all and will be destroyed. Second, why 20 seconds? Because also the physical movement, we do it while we wash carefully, and using the water itself can also make the virus particle to go away from your hand. That's the first thing, washing the hand. We also can use the sanitizer, hand sanitizer, but the hand sanitizer should contain at least 60% alcohol. At least 60% alcohol. 70-80 is fine. This is for the hand sanitizers. Okay, so what else? Never ever touch your eyes, nose, mouth with unwashed hand. That's a very dangerous. The number 4, actually wearing the face mask, or for when you, especially in crowded area or in really very narrow and closed areas and with many people, we should wear the face mask. But we should keep saying in face mask. If you are in house or some really places not good, especially the mask you can deal it if you are sick, or also if you deal with some people sick. But in our country, sometimes we have really shortage of the mask, so it's better to we give or supply this mask to the caregivers and like health cares or for medical doctors and nurses. That's the important things. But these 4 things, washing your hand, soap, or you can use the hand sanitizers, or at second, never touch your face, especially eye, nose, mouth with unwashed hand. So, and if we got actually a place, if we need to disinfect actually some places or house or our house or our work or our shop, whatever it is, how we can actually do the disinfections? There is some actually disinfections chemicals are in the market. First, the alcohol, 70% alcohol, you can wash all your surface and the places, so with 70% alcohol. Second, actually, we can use the bleach. We can use the bleach 1 to 50 bleach solution. So we just have 1 cup from bleach and 50 cups from the water with the same cup. And we can use also some other material like acetic acid, the vinegar, but we should be careful from the bleach and vinegar because the bleach can first affect some clothes materials and bleaching the color itself, and also the acetic acid can be corrosive to many of the metals. But away to one thing, never mix actually between this material to each other, especially like alcohol and chlor or the bleach with ammonia or something. No, just using water and bleach and or alcohol itself. Some chemical can cause actually this, and we should be careful that actually the alcohol should be ethyl alcohol, not methanol. The methyl alcohol is really toxic materials. So now actually we know how we can protect ourselves and our hand or we have our houses. But nowadays actually all of us hear about why we should actually all people telling us like, no, you should stay home, you should be not keeping away from the people, at least as much we should be at home and be isolated and self-isolation at home, I mean. So why? The why actually to protect the chain of transmissions. In any infectious disease, there is so-called a chain of transmission. What is the chain of transmission actually? If we imagine that someone actually is infected or with the virus, this causes infection for two persons. Then this two person cause another infection to another two person, and so on. So we will have 1 cause for 2, 4, 8, 16, 32, and 64 patient and an infection in the society. Why we should stay at home or self-isolation to actually cut this actually chain of a transmission. If we cut it, like, remember, if here someone is being not actually in the place or you are away, so you will protect other people from it, then we can really be sure, and we can really fight the infection, and we can actually combat it, and then we really decrease it. This is actually why nowadays is really important to stay in away, because the other actually in the infectious disease, something is called a community transmission. Usually the infections come when we deal together. You deal with some infected person, but the community transmission, that actually two persons, they are not knowing each other, but by chance they be in the same place, and they cause the infected person to cause the other, like the infection to the healthy person without knowing him. It's just a chance meet them together. When this community transmission occur, it's really big disaster, and we can see many different countries have occurred. Even here in Korea, it's happened, and I will tell the story of the infection, how it's the spread of the coronavirus in Korea, how it's happened. So in Korea, actually, it was everything okay before 21 February. At the time, there is one case called the 31 case. It was a lady, a woman actually, 62 years old. She was a little bit irresponsible. Even the government here did a lot of the effort to protect the people, and people also corroborate. But she was really irresponsible. So this lady was having some symptoms, but she did not care about them. So first, she attended actually the church service for 2 times. There is many people were there. So, and also these people, it's around, maybe was thousands, I think 1,000 or 2,000 person. So these people are go back to their places, infected other, and so on. Now in Korea, there are around 900,000 case of positive of coronavirus from 31 case. Only one person who caused all of this disruption, the main source of transmission in Korea. How they combated the government did maybe one of the greatest now in the world to fight the coronavirus. Actually, with 2 things: transparency and science. People are really cooperated. People everywhere they go. There is no any work have been stopped or shop been closed in Korea. But the people really cooperated with the government. People stay home as much as they can. If they get out, everyone has his own face mask. Also, they keep cleaning and washing their hand as much as they can. So now is really important for us, all of us. It's cooperation with our government to fight this one. How we can do? Stay as much as you can at home. Don't go out as only if you need an emergency to buy some stuff only. Let's stay home. Let's cut the chain of a transmission, and we together, and by our government effort and also with the people knowledge, we should do that. Collaborate together, then we can fight the coronavirus spreading. May Allah subhanahu wa ta'ala protect us all with our knowledge, and inshallah, bi'Iznillah, all of this disease will go away soon, inshallah. Just keep in mind, please, just follow the simple way. Wash your hand, keep the face mask as much as you can away from the people. That will be, the chain of transmission will be cut, and everything will be okay. I hope this video will help, and please spread it as much as you can. Then we can all get our knowledge, and we can make the people from here, from Korea, I'm telling you, everything and most of the stuff is depend on the people. If the people cooperate and be good, it will be okay. But remember the Italy, what's happening now. May Allah subhanahu wa ta'ala be with them and save them, because we're irresponsible and careless about the self-isolation, about this cleaning and protection stuff. Please be away from this stuff, and Allah subhanahu wa ta'ala protect you. Assalamu alaikum wa rahmatullahi wa barakatuh.